Prostate is an organ located at the base of the bladder. It assists in reproduction, contributes to a portion of the ejaculate. As men age, the prostate enlarges and gives men a condition called BPH, or benign prostatic hypertrophy. More concerning and more importantly is what we'd like to talk about today is as men age, the prostate can get cancer. So PSA stands for prostate-specific antigen. PSA is a protein made by the prostate, and scientists in the early 1990s discovered that patients with prostate cancer have an elevated PSA. Usually when they detect an elevated PSA, a patient is referred to a urologist who specializes in prostate cancer. Despite the current recommendations of the U.S. Preventative Task Force Services, I would like to take some time to review the recommendations for PSA screening by the American Cancer Society, the National Comprehensive Cancer Network, and the American Urological Association. Men should get screened initially, have their initial PSA test and digital rectal examination at age 40. Men from 50 on up should have a PSA test and a digital rectal examination every year until age 75, and others recommend screening until a patient has a less than 10-year life expectancy. Prostate cancer, first of all, is a very common disease process. We know that 1 in 6 men get prostate cancer. In the United States in 2011, 241,000 men were diagnosed with prostate cancer, and of those 241,000 men, 31,000 men actually died of prostate cancer. With PSA testing now, the majority of men are diagnosed when the prostate cancer is still localized to the prostate. The only way in these early stages of prostate cancer we detect prostate cancer is with a PSA test, the blood test. Unfortunately, by the time men have symptoms, that is bone pain, back pain, weight loss, or inability to urinate, the prostate cancer has advanced far enough that it is no longer curable. So the best way to detect early prostate cancer that is treatable and curable is with PSA testing.